Good day, doctor. How are you?
I'm fine. Good day.
Good day. Nice to meet you. Is the patient ready?
Yes, yes.
Okay. May I see him? See them, please? Okay. Hi. All
Okay,
right. Thank
go
you.
on.
All right. Hello, sir. How are you?
Uh,
Oh, I'm sorry.
we can't hear you, but
Okay.
I
Good.
can. I'll be a translator. Okay.
Okay. My name is David Turner of the Ally Initiative in Georgetown University, and I'll be diagnosing your sickness today. Can I ask the patient
Go
how
on,
old he is?
David. Shekara Kala. He's 25.
25. Okay. And may I ask him, does he have a job?
Me, Sana Anta. He's a businessman.
Businessman. Okay, excellent. So can you please ask the patient what is he feeling for the past time and why is he in today?
Okay, me, Samika. Samika. He has fever, abdominal pain, and dizziness.
Yes. Okay. Can you ask him if his fever is on and off or is it like getting higher and hotter and hotter?
He has abdominal pain. It's on and off.
On and off?
On and
Okay.
off.
On and off. All right, thank you. Do you mind if we run an RDT test?
Okay. It's positive.
Positive. Okay. Can you tell me how many pluses there are?
Two pluses.
Two plus. Okay.
Mm.
So I would say that the patient only has a case of uncomplicated malaria, and I would recommend that he simply takes an ACT and that he just stays healthy. He stays away from any mosquitoes or wet spots, and that he wears long sleeve shirts as a businessman. Of course, he can do that, and that he just sprays himself with bug spray should he go outside at any time.
Are you done?
Yes, sir. I'm done.
All right. That's a fair attempt, David. Mm. That's a fair attempt. Okay. But you can improve on that. Okay.
Okay.
Ask the symptoms. The more you ask, you could have asked more symptoms. Okay. Um, cough. Is there cough? Is there fever? Oh, when you ask about fever, but other symptoms, dizziness, fatigue, okay, to determine whether the patient has symptomatic anemia, cough, whether he has associated ARI, cough, sore throat, okay, all those things, abdominal pain, which the patient has and you did not ask, um, to rule out other differential diagnosis, which could be typhoid. The investigations, any patient that comes with fever, you give him a blood count, okay? See the especially the pack cell, the hemoglobin, okay, if it's whether or not it's anemic or not. Um, Other investigations, blood film, which you now request for, which is the gold standard for malaria, and then you won't know whether the malaria is complicated or not if you ask the patient a few symptoms, okay? Because the complication you can determine it from history by asking about symptoms and also as well as investigations. You do a blood count, see the hemoglobin, sometimes come with anemia, okay, have complicated malaria. And then the treatment, I'm not sure whether you talked about treatment or not. Treat with oral ACT if it is a straightforward malaria, uncomplicated. If it is a complicated malaria, you treat with parenteral drugs, okay, IV intravenous medications. Then I also treat symptomatically. Okay, you treat fever, you give him antipyretics. if he's dehydrated, you give him IV fluid, okay? All those supportive treatments, we call it supportive treatment. Then prevention, I think you've done well on that. Overall, I think it's a fair attempt, okay? It's a fair attempt, but it can be better. It can be better. So try and work hard next time and do better than you did. It's a fair attempt, like I said. All the best.
All right, thank you, sir. Only the best to you.
All the best. Thank you.